Hello, and welcome to the Power Up Nursing Be Bold Nurses Month series. I'm Melissa Mills, and I'll be your host today as we explore what it means to be brave as a nurse. A bit about me. I am a Power Up Nursing National Board member and have been a nurse for 27 years. I currently serve as the Executive Director of the Commission for Nurse Reimbursement and the Head of Content for Cinematic Health, a curriculum company specializing in frontline caregiving staff development. Let's dive right into our topic for today. Everyone knows that nurses must be compassionate, empathetic problem solvers who come to work with a heart of gold, enough pens to lend one or two, and a sense of humor that sometimes is a little different. But did you ever think about the need for nurses to be brave? This is a quality nurses possess that isn't often talked about, but is a skill that we have on many levels. Bravery isn't just about running into burning buildings or rescuing people in the field. It can be found in advocacy, decision making, and even quiet moments spent with patients. Now we're diving into bravery with two of our Power Up Nursing's National Advisory Board members, Leanne Meyer and Angel Hoffman. Welcome, ladies. Let's start by doing quick intros about your backgrounds, and I'd love for you to share what bravery in nursing means to you.
Well, I can start. I'm Leanne Meyer, and I have been a nurse for 50 years. I have worked, I'm most known, I guess, for my Once a Nurse, Always a Nurse international talk show for nurses. And then I was a co-founder with Tanya Brea and Dr. Alba Rodriguez for Power Up Nursing, and also a co-founder for Nurses Transforming Healthcare. So that's kind of my start. What is brave? Say the question again.
What bravery in nursing means to you?
Bravery in nursing means to me that we have to be very, very clear about who we are, separate from other health providers, but collaborative with all other health providers. And we need to be very clear about who we are, and then have ownership of our own career area, and take ownership of that, rather than sitting back and waiting for people to assign something to us.
Yes, I love that. Nurses are brave just by being who we are and using our training to the top of our scope of practice. Angel, would you like to introduce yourself?
Sure, I'm Dr. Angel Hoffman. I have been a nurse for 46 years. I don't readily admit that, but, and I always try to say I started my career when I was 5. So just
exactly.
So you know. Exactly. But actually, this is a very important topic to me, because I believe that bravery is a nurse having confidence, a nurse having courage, a person that's honest and has integrity, and is not intimidated by others, regardless of their title or their position.
Yeah, absolutely. I love that. So let's talk about bravery in terms of the power of speaking up. Let's talk about, have you ever had a time where maybe you were scared to speak up, but you did it anyway? You used your voice to support patients, to support other nurses.
What I learned is that I'm very brave when it comes to standing up for patients and other people, not quite as brave when it's about standing up for myself. So that's something I've had to work on. But mainly about being brave, I think we just need to be confident enough that we know what we're talking about. Sorry, my phone is still on. And have background information, have data to support what we're saying. That will also make us more confident, and we will sound to others like it's not just our opinion or an anecdotal thing that we're saying.
Yeah, I love that. I think so often nurses, we feel, right? We are feelers. We have that gut instinct, but we work around people who aren't always feelers, right? When you go to the CEO, when you go to the CFO, they might not be feelers. So having that data, having information to back up those feelings is so important. How about you, Angel? What Have you ever had an experience where you've been scared to speak up, but you did it anyway?
So first, when I was first orienting to being a nurse for the first time, I had a physician yell at me. I had never talked to a physician on the phone before, and he was screaming at me about something that was out of my control. Well,
Yeah.
that had a great impact on me. So a few years later, as a seasoned nurse, I actually had a patient who was going into septic shock, a young patient. And the patient had had surgery, a ruptured appendix. So, you know, the complications that could come with that if you're already a healthcare provider. And so I called the surgeon, who was a well respected, you know, very important man in the organization. And he basically dismissed me and my concerns. And at this point, I'd been working in intensive care.
Mhm.
So before hospital, this is far back, but before hospitalists, we had evening physicians that would moonlight. And as soon as that physician like hit the deck, 7 p.m., I called him stat and said, "You need to get here to the ICU." He goes, "What's going on?" I go, "My patient's in septic shock." I mean, he's going into it, you know, kind of thing. I could see it happening. And he said, "Well, did you call the physician, the surgeon?" I said, "Yes, I did." "And what happened?" "Nothing. He dismissed me." So he assessed the patient. He called the physician. He said, "That nurse is right." And I'm putting him on triple antibiotics. The next day, I came in for my 3 to 11 shift, and that patient had been discharged from the ICU and was now on a general unit.
Oh my gosh.
Wow.
I had a similar situation to that with a doctor who was notoriously negative toward nurses. And I was a labor and delivery nurse in the middle of the night. And I had a patient that I just had a feeling, you were talking about feelings before, that something was going to happen to the baby. I felt like it was just going to crash at some point. And I had nothing, you know, on had the mom on a monitor, and there was nothing there that was showing me that this should happen, but I felt like it was going to. So I called the doctor and asked him to come in. He started screaming at me. I had to hold the phone out arm's length away because it was so loud. I ended the conversation with him, went back to the patient. He called me back 3 separate times to scream at me. And the third time, I'm standing at the desk watching the monitor, and the baby crashed. And fortunately, because similar to Angel, I wasn't going to take no for an answer. I called the neonatologist to come in, and he was walking off the elevator just as this happened. And I said, "I'm sorry, doctor, I have to go. The baby just crashed." And so he ended up coming in. He stole the paper from the monitor and took it away because he wanted to prove to me that I had missed something. And after almost a week, he came back. He pulled me aside, apologized to me, which no one had ever heard him apologize. And he said, "I don't know how you knew this. There is nothing on this strip. I've showed it to other obstetricians. There is nothing here for you to know that was going to happen." I said, "I can't explain it to you." So from that time on, anytime I called him, he would say, "What do you need? What do you want?" And he would listen to me. So I started training all of my nurses to realize you have to stand up to doctors for them to really value your input. If you cave every time and, you know, are a puddle of tears, they have no respect for you. And the way you get respect is to stand up, be confident, and make sure you're doing what you need to do, just as Angel did. Call the doctor even if they say no.
Yeah, I love that. I had a similar experience when I was in the neonatal intensive care unit. We had a baby that actually ended up celebrating his first birthday in the NICU. And an ortho who was a world-renowned orthopedist came in and was standing at the bedside, and he said, "This baby," and we were short-staffed. I had multiple babies, you know, everybody other than this particular baby, they were all vented and had multiple drugs and drips going. And he said, "This, he has a booger." And I grabbed a tissue and I handed it to him. And he just looked at me and I said, "Does your wife not make you wipe boogers at home?" And he goes, "All right, I'll wipe the booger." And so he did. And I never had a problem with him ever again because we had an understanding. I was like, you can take care of this baby just the way I can, right? So I think it's a beautiful thing when nurses use our voice, we speak up, whether it be something, for advocating for patients or other things, which now let's go into advocacy as a form of bravery. How can nurses be brave advocates beyond advocating for patients? We always talk about patient advocacy, but there's so many other ways to be an advocate. And Leanne, I know that you have, many different things that you've done throughout your career and organizations you've been involved in. And I'd love to hear how you use advocacy as a form of bravery outside of patient advocacy.
There's so many things that as nurses we feel need to be done, but mostly we feel powerless. If we go to the CEO and they don't listen to us, we think we're done. And I think that nurses, again, we need to encourage each other and support each other to realize that we have a perspective that is completely different from anybody else in healthcare, mainly because we're there, 24/7, 365, but also because we come at healthcare from a completely different point of view. So some of the things that I have done is I would realize that there were things going on that I thought needed to change. And initially I had this naive idea that the doctors wanted, the best things too. And were willing to change if they could hear something that was better. So really paying attention to how things were going. This might be a little bit more patient advocate too, but as I was in a labor and delivery position, I was also working in the neonatal ICU. And we had a doctor who would come in and do circumcisions. And he was an amazing surgeon. And he would do these circumcisions. He'd line up all of his babies. Often it could be 5 or 6. And he would go put on gloves, go right down the line and put in numbing, put on the clamps. And he would do that for each baby and then go back. And he would take a different scalpel. But basically, he was going right down the line and cutting off the foreskin of each of these babies. And in the meantime, they're screaming, they're cold, whatever. And he's another guy that, nobody really questioned him. And I tried everything I could think of to get him to change that. And finally, I said, would you do this with women in labor or, for circumcision? Or for any other procedure that you might be doing as an obstetrician, would you use, I said, can you explain to me the sterile technique? And of course he couldn't. And he looked at me and he said, okay, Leanne, I will do each baby individually. I promised him I'd get them up and down quickly, and he was agreeable to that. And after that, again, we were friends. But it's, you've done something so constantly that it takes somebody that's willing to gently, professionally, that's the key, is that if you're going to speak to somebody to encourage them to do something they don't want to do, you have to come at it from a professional point of view, respecting them and not putting them down. And so it takes a relationship, and that's whether that's with the CEO, whether that's, other head nurses, if that's, somebody on the outside, having that respectful relationship all the way along, so that when that difficult conversation comes up, you have a platform and a connection. You have a place to be able to start from that they can listen to.
Yeah, absolutely. Those relationships are so important because, like you said, when you've put in that time and you have that relationship, then they're more willing to listen. Angel, how about you? Have you had any experiences with advocacy beyond patient advocacy? I'd love to hear your take on that.
Sure. So I've worked in the bedside, both on the units and the clinic and critical care, but I also worked in risk management, and then I went into corporate, where I actually was a chief ethics and compliance officer for many years, many places, and a healthcare consultant. So why do I tell you all that? The whole time that I was doing that, I was also an educator. So what I realized throughout my career is that I was doing education both formally and informally. And I think that the education, not only of the nurses, but the other colleagues that I worked with, sometimes they didn't even know they were being educated.
Yeah.
And so, in order to support the nurses, I've had to educate others so that they would treat them better by recognizing what a wealth of information nurses are. And I also had to educate the nurses to let them know, hey, you're a wealth of information.
Yeah.
You're right there in the center. I have something that I draw for my students. And if you go back to your biology days, you'll think of a cell with the nucleus in the center and then the cell wall. And what I tell the students is, here's the patient, and I draw the cell wall. And in the center of that cell wall, I have the nucleus. The nucleus is the patient. The cell wall is the nurse.
Yeah.
And everybody else has to penetrate the cell wall to get to that patient. That
Wow.
opens up a whole new world for those students.
Yeah, yeah, I love that. The imagery of that and the power, right? We have power because, like Leanne said, we are there when everyone else has gone home. We're at the bedside, we're still caring, we're listening. And there's so much power and bravery in just being that person who is managing everything that's happening with and for that patient. And I think a lot of times as nurses, we forget that, right? We think, well, I'm just a nurse. How many times have we heard that? I'm just a nurse.
I never want to hear that.
Me too.
Yeah.
We
I
are
scold
nurses.
people for saying that.
Yeah. Yeah, absolutely. There's so much power in what we do and who we are as part of that healthcare team. I think, Leanne, did you have something you were going to say?
I was going to say, with the education part of it, as a 2-year nurse, I had moved from Denver to Wisconsin and was in a small hospital who had nobody had ever heard of SOAP charting. So that was back, 48 years ago, and it was a new thing. And I was, realizing it was really important that we bring these things up to speed. So it turned out I was the only one who knew anything about it. And so I volunteered to basically change the entire hospital, all of the different units, every aspect of it, including the doctors, charting and all of this. I had to, and so I brought a committee together and we did it together, but I had no idea how big this project was going to be. It took us probably more than a year to get it all completely put together. And eventually we had almost everybody coming back and saying, we didn't know about this. And truly it does help in how people are communicating to each other from different departments. So that was a really scary one that was not specifically for patients, but really made a big difference.
Yeah, and I love that because that goes straight into our next question. And it's really talking about being innovators. And I think a lot of times we think, why I've never created something, or, I don't have any patents, but nurses are innovators every day. So talk to me a little bit about some of the ways that you've been part of making nursing better, that you've been a change maker or an innovator throughout your careers.
Do you want to go, Angel?
Okay, sure. Both practical and then administratively, I feel like I've done several things, but 2 things that I'll mention to you is as a younger staff nurse, you would say, I need to connect this tube to that tube, but there's no connector. Then we would think about something and go, well, the NG tubes have a connector. So I'm sure this is waste and we would be chastised for this, but we would open up an NG tube, take the connector, connect the 2 tubes that maybe something was coming from the abdomen or bladder or something like that, and make it happen. And I can tell you that not only in my personal life, but in my colleagues, nurses are innovators. It doesn't matter where you put us. I mean, you could have us in a restaurant. I mean, it doesn't matter where you put us.
Yeah.
We are problem solvers. We're innovators. And people go, how'd you ever come up with that idea? Well, that's just nurses. Mm-hmm. The other piece is one time I had a manager who told me that I could not have the needed FTEs that I needed for my intensive care unit. And I knew she was wrong, but she totally didn't get it. So I had to develop a budget. So I did. I developed 3 for her. One was pie in the sky. There was no way in the world they were going to give me that. And I knew that. The third one was actually one that was so terrible, the patient care would suffer. But the
Mhm.
second one was exactly what I had wanted within the dollar amount that I knew would be allowed. It was exactly what I had told her. And sure, I got chastised for the first one because that was pie in the sky. The
Mhm.
third one, are you out of your mind? You have to go with this middle one because that shows. Look how many holes you have. I'm like, oh, you are so right. I got exactly what I wanted. But it
That
wasn't for me. It was for my patients and for my nurses.
yeah, that's
It's
amazing. I love that story.
it's one of the things that nurses kind of get dinged for is our manipulation. But we found many times that's the only way things get done is if that person thinks it's their idea, they're willing to go with it. But if they think it's your idea, maybe not so much.
Yeah. Yeah. How about you, Leanne? Talk
Yeah.
to me a little bit about
Oh, I've had so many things that are innovation. A little more recently was when I did my Once a Nurse, Always a Nurse. It was a live radio show that was done once a week, and it was international. And I didn't know until many years later that I was the first one to do that.
wow.
Hadn't even occurred to me. It was so fun. I got to sit in basically my living room and talk to people all over the world and learned so much about nursing beyond our own shores and realized how many things are similar. I also learned a lot of things that in the time period I had been out of nursing, I didn't realize how much the burnout and some of those things. When I was a brand new nurse in Denver, 50 years ago, burnout was a word that was just coming into vogue, and when I realized that was what I was experiencing, even in later years as I looked back on that time period. But the innovation really helped me have not only me have a voice, but when COVID came around, I realized I have a platform for nurses to finally be able to speak up. And so I made that platform as broad as I could possibly do. And near the end of my time doing the podcast, it ended up being a podcast. I had 120,000 listeners in 70 countries. So, and
Wow.
I knew nothing about it when I started. I just knew I love nurses, I love nursing, and I wanted to, have a platform for them.
Yeah, that's beautiful. That's beautiful. Because I think so many times we don't have a way to get those stories out, nurses' stories of things that they've done. And a lot of times we hear about all the negativity, but there's
Yeah.
so much positivity that is in nursing, even today, even with the problems that we have. When I think of innovation, I also think I was a home health nurse for many years. And every time I went into a house, it was a different situation, right? There maybe I was doing wound care and there were 30 cats in the house, or maybe I was doing, something where, the patient was a hoarder and there was just a little teeny tiny path to get through the house, and I had to think outside of the box constantly to do what was best for the patient. And that is innovation. And I love, Angel, your stories of innovating and showing different ways for nurses to get what they need. I think
And
we
you know
don't
what?
talk about that enough.
And you know what? We don't see that as ourselves. For us, going the extra mile is just all in a day's work.
Yeah. Yeah. And Leanne, you said it best when you said you advocate so much easier for others than you do for yourself. And I am the same. I resonate with that. How about you, Angel? Do you resonate with that as well?
Definitely. And I think you could see that in my budget experience and the fact that it wasn't for me that I quote won, it was for my patients and my staff.
Yeah. That's the one thing. Patient care is the one thing that I think all nurses can get behind, right? We all agree that taking care of our patients is the most important thing. Well, this has been a really great time together and learning about both of you and ways that you've been brave throughout your nursing careers. And so I'd like to wrap up by providing our listeners with a challenge. If each of you could think about what would be your challenge for nurses, your brave challenge for nurses today? What's one brave thing that you challenge them to do or try this week? Angel, would you like to go first?
Sure. I like to think of when I tell this to nurses I'm working with or my students, I tell them, speak up, be knowledgeable, use the knowledge, the assessment, your plan of care, and all of that to get your point across, to put that picture together so that you give a presentation to the physician that's all together. You're not, like you said before, sifting through labs or whatever. You present the picture, and you even give some, potential suggestions. I thought you would like to know this because, so you show them that you are a very educated person who knows what's going on. And even in some examples, you may have, and I've had to do this too, provide citations or examples to show that this was the right thing. Leave the emotion and the attitude out of it. You are a professional. You don't get hurt feelings. You are a professional. And the last thing I can tell you is this: be a role model.
So powerful. So powerful. Leanne?
Yeah. I'd like to challenge every nurse on their unit or wherever they are, if it's clinic or wherever it is you're working, to create a collaborative workplace. So many times I heard people saying that, we have chaos on our unit or in the hospital. And I always go back to, what can you do? What part of it are you? Are you a part of the problem or part of the solution? And the amazing thing is, you really don't have to wait for money from above or, permission from anybody. You can start being kind and respectful and generous with each other, and even sit people down on a break or if you get a break, and talk about how could we make this unit run better just from what we already know, what we already have available. And that is each other, and, sharing, offering to help somebody make a bed quickly, or, some major thing is the place is blowing up with everything going on in 16 different directions, and trying to figure out, what do we need right now? Somebody take control to say, how can I make sure that we're getting what we need, rather than everybody running in all the directions and there's no help coming. If there's one person who can figure out, we need somebody at the desk to handle the phones, we need somebody who can take patients to other departments or whatever. Those couple of phone calls can help make the rest of it go well. And if at all possible, if you can assist somebody, even if it's just for a few minutes in whatever it is they're trying to do, to get them back on track. Or it might be talking to them and help them talk through, have 20 things that have to happen at the same time. Just quickly help them think through what's most important. What can I do most easily? Is there somebody else that, can we call somebody in early for the next shift? Can we keep somebody, from the last shift? What can we do? And, worry about the negativities afterward. You can always explain. If you can back up why you did what you did, you're unlikely to get in trouble. If you have a good reason for why you did what you did.
Yeah, absolutely. So be bold, be brave, use your voice, speak up, be collaborative, and be a role model. I think that's a beautiful way to end our time together. Be a role model, be the nurse that you needed when you were in the trenches. Thank you so much for joining us today. And please follow Power Up Nursing, and you can find us at www.powerupnursing.com.
Thank you, Melissa, for all you do.
Thanks for having us today.
Absolutely.